Yeah, I think one thing I think is really important in the healing process is that the person takes an active part in the process. Yes, there are some things I can do for some people at some times that, whether it be, doing active release or doing some energy medicine, yes, they can play a passive role and they can get a great benefit. And I would say it's in the overwhelming minority of people that have come to me and played a passive role in their progress and got rid of something completely. Now, there's a few examples I can think of where people have come to me. The one that springs to mind is carpal tunnel syndrome. And just purely through getting treatment, it was gone. But in the vast, overwhelming majority of cases, the person needs to play a role in their own recovery. And I see pain as a messenger, right? Pain. A lot of people have described pain as being a danger signal, right? But I see it as a messenger from your subconscious mind to your conscious mind, trying to make you aware of something that you need to address. And when you play an active role in that process, you're far more likely to get the result because your body's trying to tell you something. It's something you need to learn. And if you're just playing a purely passive role, how are you going to learn anything? You've got to be part of the process. So I really like the fact that the melt, method involves the person in the process. I think that's really important.
Yeah, because again, like you just said, we can do lots of hands-on treatment, but even within my practice now, I think that's what I've moved away from now. You'll always get some patients that actually want you to do it for them. But there are a lot more and a higher number of people now that actually want to take responsibility for their own well-being, whether that be because, financial or, just to be more integrated with what they're doing. I think it's really valuable. And that's, like you just said, Melt is self-care. And there really isn't, again, there's no self-care out there that will do everything the Melt method does. Um, I think, and they can actively take a massive part of their healing. And the thing is, once, with a melt class, for example, I guarantee from the minute that they start my class to the end of the class, if I can do 2 moves on the melt method and I've changed my whole posture and my whole alignment, just like that. Doesn't have to take very long at all. And when they see those results, they want to do more of it because they know how great it is. So I had a break for 2 weeks over Christmas and then, started back in January and everyone's like, oh, it's just been so nice to come back to do the Mount method because, they're with me for an hour. But as I explained to them today, your self-care doesn't have to be an hour. Fascia loves dribs and drabs. It loves 10 minutes here. It loves 5 minutes here. If I've been hands-on and my back was playing me up, but, I'm still got to do a full patient, a whole clinic, I'll have my melt roller and I will just go into the back room. In between treatments, I might do a little bit of technique to release my upper back because number one, that's going to decrease all the tension in my lower back anyway. It's taken me 1 minute and I've gone back in and my ribs are elevated. I've got better posture and I'm like, great. So I think you're right. When people start to see those kind of results, they're more invested in their own self-care because they know it's not going to take months to sort of like start helping them with their pain.
If this sparks something for you, there's a much deeper conversation in the full episode. You can watch it here on YouTube or on Spotify or listen on Apple Podcasts. Like, subscribe, and stay connected for more.